Researchers say they found conclusive evidence showing cannabis use can speed up the onset of serious mental illnesses like schizophrenia. The Australian study shows those most at risk are young people whose brains are still developing.
It's the most widely used illegal drug, with 1/3 of Australians using cannabis at some time. It's sometimes seen as a benign drug, and there's been conflicting evidence about whether it can cause mental illness. Now Australian scientists have strong evidence that using cannabis can bring on psychosis.
The main finding is that cannabis use is associated with, on average, 2.7 years earlier onset of psychotic illness.
There's been a lot of uncertainty in the field about the relationship between cannabis and psychosis, or one of the particular psychoses, schizophrenia. And this is a definitive and important finding.
Researchers from the University of New South Wales reviewed 20,000 cannabis users. They found reducing or stopping drug use could delay or even prevent the onset of psychosis. And the more frequent the use and the earlier the smoking starts, the greater the risks.
I think there are a proportion of people who develop schizophrenia and who would not have developed schizophrenia if they hadn't smoked cannabis, maybe 20% of patients.
Their findings support the theory that using cannabis can actually cause serious mental illness.
School drug education should be conveying this message in a general way, even in early primary school.
Researchers say the findings reinforce the need for strong warnings about the health effects of cannabis. Sophie Scott, ABC News.